Hi guys, my name's Dr. Nitesh Patel, a GP working here at 21D. And today I wanted to talk to you a little bit about depression. Now, as you may have seen in a previous video about anxiety, mental health occupies over half of all GP consultations. And like I said, anxiety and depression cover the vast majority of those. Now, depression's more than just low mood. It can be lack of energy, it can be lack of enjoyment, just not wanting to do anything. That may be not going out with friends, that may be just sitting at home. It can be actually overeating or undereating and using food to actually find comfort. It may also be a loss of hope, or you feel tearful or guilt-ridden, and actually it overlaps a little bit with anxiety as well. Now, some of the more severe symptoms of depression are thinking about self-harming or actually thinking about ending your own life. And if you are thinking about any of these things, I implore you to seek some medical help. Now, it doesn't actually have to be seeing your GP. It can be speaking to the Samaritans. It can be speaking to Mind. There are many charities out there that can help. But the most important thing is that you are not alone. And there are many people out there who want to help you. Talking about how you're feeling is very important. They do say a problem shared is a problem halved. Now, that might not always be the case, but actually, people don't want to tell their friends and family about what they're thinking. And it's interesting, because if you flipped it, you would want to know if a friend or family member was feeling the way you were. And you would want them to know that they could confide in you. And I can guarantee that's what your friends and family would like to know about you. Talking to them, however difficult it may be, can prove vitally important and can be the first step to helping. Now, you don't need to go in a whole huge ramble to start with. You may just say, I'm struggling. Just saying those words, getting that feeling out, just doing that can really help. Now, some forms of depression can be situational. It can be changing with the seasons. So actually in winter, some people feel very low and struggle. And in summer, they feel a lot better. After having children, some women really struggle with their mood. And it's a recognised condition of actually feeling very, very low or depressed. Now, it's often under-recognised, these types of situational depression. And recognising it and talking to people is very, very important. I've mentioned a few things. Talking to friends, family, charities. We can talk about medication. Of course we can talk about medication. But it's not always first step. Again, I can't stress the importance of just talking. Obviously, friends and family may have their opinions and may want to try and help, but actually talking to a professional when you feel ready to can really help. And we can go through in further depth different ways, different people, different charities to help. Now, none of this is easy. I'd be lying to you to say that any of this is easy. And they're difficult conversations, even just starting. But even just watching this video can be the first step. And I think it's important to know that you are important. You would be missed. And talking to someone may make the world of difference. Now, I know this video has been very different to my other videos, but I think it's really important to stress this situation. Depression is the biggest killer of men under the age of 40, because often they don't feel like they can or they should speak up. That doesn't mean women aren't affected as well. Now, I hope that this video really does help in any way. Thank you.